Nigeria is one of 17 African countries that won its independence from colonial rulers in 1960. After decades of political instability, Nigeria is working to rebrand itself from a post-colonial military state to a progressive democracy. Political, civic, and professional leaders have recognized the most intractable problem for this West African nation of 140 million is also its most treatable: maternal mortality. Nigerian health workers are battling the world's second highest number of maternal deaths. More than 36,000 Nigerian women die each year in childbirth or from pregnancy-related causes. Working to break these long-standing cycles of maternal mortality are some of Nigeria's most distinguished reproductive health practitioners. They are implementing a range of initiatives to combat the two leading causes of maternal death: eclampsia and postpartum hemorrhaging. The low-tech neoprene anti-shock garment treats women in shock who have lost too much blood after delivery, and magnesium sulfate treats preeclampsia, the rapid elevation of blood pressure during pregnancy, which, if untreated, can lead to seizures, known as eclampsia, and followed by kidney and liver damage, and ultimately death. Recent Population Council research in northern Nigeria reports the use of magnesium sulfate led to a 2/3 reduction in maternal mortality due to eclampsia. Results from a comparative study showed that women who received the anti-shock garment lost 50% less blood and had 64% fewer deaths and severe disabilities than women who did not receive the garment. Considering the vast scale of maternal death in Nigeria, are evidence-based strategies such as these able to be replicated across the country? New awareness has been borne by this research, yet the excessively high maternal mortality rates in many sub-Saharan countries has experts still searching for the right prescription to close this gap. In April 2010, The Lancet published a worldwide study on maternal mortality conducted by the Institute for Health Metrics and Evaluation at Washington University. For the first time in decades, researchers are reporting a significant drop in the number of women dying each year from pregnancy and childbirth, citing more access to family planning and girl-child education. The new findings from 181 countries show an annual decrease of 1.3% in the maternal mortality ratio, which is the ratio of the number of maternal deaths per 100,000 live births. However, Nigeria moved in the opposite direction of this global trend, with a 1.4% increase each year, from 473 per 100,000 live births in 1990 to 608 per 100,000 live births by 2008. Farida Babale is the head nurse midwife at Murtala Muhammad Specialist Hospital in the northern state of Kano. She has more than 20 years of midwifery experience and has worked on the front lines of maternal care throughout northern Nigeria. Farida attributes recent improvements in the maternity ward to political will at the state and local level and the influx of NGO support to combat postpartum hemorrhage and eclampsia. In the rural southwest village of Mele, Professor Oladosu Ojembedi and his team from the University Teaching College in Ibadan conducted a baseline survey of reproductive health practices. His team began implementing a pilot project to make motherhood safer in this remote farming village. Elizabeth Adeshina, a community birth attendant, is participating in the project and has received training in communications, diagnoses, referral and transportation, and low-tech interventions for safer pregnancy and delivery.